Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Integrative Movement Insider. And this is part 4 of a 5-part series on working with your clients, safely and successfully progressing your clients in their core exercise progressions, especially those clients that have spinal conditions, common spinal conditions such as disc issues, osteoarthritic changes, and or spinal stenosis. Because so many of our clients will present to us with chronic discomfort, tightness, and or issues related to non-optimal and inefficient strategies around using their core musculature. So the abdominal wall, the erectors, the glutes, psoas, and pelvic floor, as well as the other spinal stabilizers. And as we've been discussing in this series, I walked you through the 3 secrets, really the 3 keys to maintaining and developing and maintaining an optimal core strategy. And more importantly, it's also efficient and sustainable. The first secret was to help your clients not grip in. So too many of our clients are overbracing their abdominal wall or squeezing their glutes and changing the position of their pelvis and lumbar spine and altering the alignment and control of the thoraco-pelvic cylinder. Secret number 2 is to allow your clients to maintain or to help your clients develop and maintain their most optimal neutral alignment, which we'll discuss further in this 4th video. And the 3rd secret is to use the most appropriate progressions. Teach your client how to find and control neutral alignment in a variety of positions. So supine on their back, prone face down, quadruped on all 4s, half kneeling, and or the upright position. So that way they develop the alignment and control that they ultimately need to take into all their exercises, as well as that 3-dimensional breathing. And then use the appropriate progressions, because too many of our clients are using progressions that are too advanced, and or they fatigue out and they start to lose alignment and control, or they lose their breathing and start using non-optimal and inefficient breathing strategies, which sets up the core for non-optimal and inefficient sorts of strategies, and then they take that into everyday life. So our responsibility, your responsibility with your client is to help them develop and maintain the most optimal and efficient strategy that they can. So the first step is helping your client find their most optimal and efficient neutral alignment. So I'll demonstrate what that looks like in the supine position and then also in the upright position. Then in video 5, I'll take you through a progression of how to train this neutral alignment. Now remember, I'll just demonstrate how to get into it and how to help your client find their most optimal and efficient neutral alignment. However, you may have to modify this for some of your clients depending on how they're presenting to you. You'll have to do soft tissue release and or manual therapy work to help them to release those common areas of restrictions like the posterior hip complex, the erectors that are overactive, or even if they're abdominal grippers to help them release and relax through their abdominal wall so they can even get into that neutral alignment. So as I demonstrate what neutral alignment or how to find neutral alignment for your clients, remember that you've already done, you'll need to do soft tissue work to help them get into that position without forcing them into the position. Because the most important thing as part of the strategy of helping your clients find a more optimal and efficient neutral alignment is helping them get there in a more effortless manner, meaning optimal and efficient manner. Because too many of our clients, they'll stand in positions where they pull their abs in and squeeze their butt, so they may look like they're in good alignment, but they're using too much effort or a non-optimal strategy to be there. So we want to find a position, their most optimal neutral position, where they can get there, it feels good to be there, and they can maintain it, relatively speaking, with very little effort. So I'll demonstrate the supine position and then the upright position, and then again in video 5, I'll show you how to train several progressions to train this position, so that way your clients, regardless of the spinal conditions they have, can safely and effectively use their core and perform the most effective core exercises. Begin in the hook lying position. The pelvis should not be in posterior pelvic tilt with lumbar spine flexion, nor should it be in a position where the thorax at the thoracolumbar junction is hyperextended, such as this. So we want the client with a rib cage aligned to the best of their ability in line with the pelvis with a slight lumbar lordosis, or if they're spinal stenotic, so at least their pelvis is neutral and not in this posterior pelvic tilted position where the pubic symphysis is much higher than the ASIS. We want to bring the pubic symphysis and ASIS relatively in alignment with each other and have a nice connection between the rib cage and the pelvis. So again, the pelvis should not be in posterior pelvic tilt as such with lumbar spine flexion, nor should it be in a hyperextended position where there's thoracolumbar hyperextension and you can slide your arm easily underneath the lower rib cage. So again, neutral spine is where the head and neck are in best alignment with the thorax, which is in best alignment with the pelvis without using a lot of effort or force to be in this position. In the upright position, we're going to cue our client very similar to how we cue them on the floor. However, we want our client to be in their most optimal and efficient neutral alignment without forcing them into a position that's either too anterior and or too posterior. So here are the cues we use most frequently with our clients here in our clinic. We have our client feel as if they're being pulled up from the backside of the head and neck and even the backside of their rib cage, as if they're being suspended by the ceiling from the backside of the head and neck and rib cage. Their pelvis should be in their most optimal pelvic position. So again, they're not in excessive posterior pelvic tilt where the pelvis is in front of the rib cage and or the rib cage is behind the pelvis. Neither are they in the sway back position where they're hyperextended at the thoracolumbar junction and their pelvis has swayed again forward of their thorax. So again, long spine, rib cage suspended and aligned and stacked over top their pelvis. Their hips should be relaxed, their abdominal wall should be relaxed. They should be able to maintain this alignment of the head and neck, rib cage, pelvis over top their feet. So that way, when they start to do their chop patterns or their rotation patterns, their goal is to maintain this alignment. So even in the plank position or doing heel drops or modified dead bug type positions, they're maintaining the alignment of their head, neck, and thoracopelvic cylinder. The thorax over top of the pelvis, maintaining their most optimal neutral position without forcing them into either excessive posterior pelvic tilt and lumbar spine flexion or that excessive anterior pelvic tilted position where they're hyperextending at the thoracolumbar junction. So I hope you enjoyed this video and it helped explain how to get your client into their most optimal and efficient neutral alignment of the thoracopelvic cylinder, of their thoracic spine, lumbar spine, as well as their head and neck. Because in the next video, part 5 of this 5-part series, I'll take you through how you use this neutral position to start to integrate this into your core exercise patterns. Because essentially what you're training your client to do when you do core exercise patterns is to maintain this alignment and to train the abdominal wall as well as the pelvic floor, the diaphragm, the psoas, the multifidi and erectors to maintain this alignment, to teach a client how to maintain alignment, breathing, and control, the principles of the integrative movement system, through their exercise progressions. And I'll demonstrate a very safe and effective progression for your clients to have common spinal conditions such as disc issues, osteoarthritis, and or spinal stenosis. So make it a great day. We'll see you next time at Integrative Movement Insider. This is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Take care.